Tobacco and obesity are our biggest killers. Tobacco and obesity make it harder for the body to defend itself. The problem with tobacco is that nicotine is highly addictive, and tobacco companies systematically and deliberately target vulnerable people. Sugar, fats, and processed foods are also addictive, and these food companies also target vulnerable people. In certain neighborhoods, it is hard to access fresh, quality food, and there are limited opportunities for physical activity. The good news is communities can change these conditions by making the healthy choice the easy choice. When things are easy, or people do things by default, it becomes the norm, not the exception. That's why the Louisiana Healthy Communities Coalition, LHCC, supports policy, systems, and environmental changes, known as PSC, to make sure improvements work and that they will last. For example, smoke-free policies mean tobacco users smoke less and non-smokers are protected too. System change happens when a farmer's market gets a SNAP card reader, so lower-income people can buy produce there, which also helps food producers increase their bottom lines. Environmental change happens with complete streets ordinances, so every form of transportation, not just cars, get counted in new infrastructure. Crosswalks, bike lanes, and public transit shelters means everyone can get around to jobs, healthcare, and recreation. Property values even tend to go up. These changes build communities, improving quality of life and health, and literally save lives. That's why the Louisiana Healthy Communities Coalition is here. LHCC connects groups working to improve health in the state by providing state leadership and resources, communications, and annual summit where people learn, share, and get inspired, and last but not least, small grants for groups to create the PSC change in their community they want to see. To find out more about the Louisiana Healthy Communities Coalition and join us, go to www.healthylouisiana.org. The Louisiana Healthy Communities Coalition's, LHCC, provides small community grants to groups all over the state fighting tobacco and obesity via policy, systems, and environmental change. Policy, systems, and environmental changes, known as PSC, are proven long-term sustainable improvements, and we let communities choose for themselves how they want to spend their grant. LHCC funds school, church, and other nonprofit community-led gardens, creating environmental changes that fight obesity, to provide healthy eats for a range of citizens, from students to cancer patients. In parts of Louisiana affected by high obesity rates and poverty, LHCC has made a significant impact. In Sicily Island, in northeast Louisiana, the nearest grocery store with fresh produce is 17 miles away. LHCC helped the First Baptist Outreach Ministries repurpose an unused lot into a fruit and vegetable garden, providing healthy produce to the community. At West St. John High, teachers and students have built a community teaching garden, hosting a monthly fruit and vegetable market. In Lafourche and Terrebonne parishes, the St. Francis Vegetable Garden people have been distributing fresh produce for years, with volunteers planting more than 100 citrus trees in public spaces. Residents can now pick fresh fruit for free, with the remaining produce going to local food pantries. LHCC, leveraging work done by the Louisiana Ag Center and Louisiana Central, have helped create both systems and environmental change in the Oberlin and Alexandria farmers markets, with, for example, SNAP beneficiaries now being able to shop there. When COVID-19 broke out, many workers lost their jobs, supply chains were disrupted, and suddenly people couldn't get food. LHCC jumped in and took up the challenge, making sure the community had access to healthy foods. LHCC funded Sprout efforts to deliver vegetable plants to elderly residents of color in New Orleans. Healthy produce was delivered, and COVID-19 was kept at bay. Using LHCC funds, Market Umbrella, Crescent City Farmers Market, and the Hammond Farmers Market developed online ordering and contactless delivery of fresh, local produce, benefiting everyone from food producers to people below the poverty line. LHCC funded the Cancer Association of Greater New Orleans, or CAGNO, to deliver contactless nutritious meals to cancer patients, while the United Way of Iberia set up many food pantries, allowing neighbors to help neighbors. LHCC also supported and funded physical activity through environmental change. In DeRidder, personal trainers demonstrated how to use park exercise equipment, and now there's signage to explain the same. In Toulouse, the walking trails were repaired. In Gina and Urania, the introduction of park benches and picnic tables inspired both physical and economic improvements downtown. While in Ola, building on its already strong farmers market, funds were used to enhance the outdoor educational public space so people could benefit from classes on everything from diabetes to stress management. In Baton Rouge, LHCC funded Front Yard Bikes, a place where disadvantaged youths learned bike repair, earned a bike of their own, and provide others with much-needed transportation. That work became even more critical when COVID-19 hit, as bikes provide an affordable, contactless way to travel. LHCC is an active supporter of Complete Streets ordinances, which requires new infrastructure to take into account all modes of transportation: walking, cycling, public transportation, etc., not just cars. In New Orleans, Hammond, and Lake Charles, LHCC has funded Better Block events where a certain space is marked off with crosswalks, bike lanes, and other transportation aids to spur Complete Streets ordinances. Lake Charles has also used LHCC funds to boost their physical activities, adding trail signs, park benches, and water bottle stations. LHCC continues to help communities in healthy ways, big and small, such as fighting tobacco in Shreveport by helping it go smoke-free, supplying smoke-free signs to Rapides Parish schools, and helping people eat and move in healthier ways, even in a crisis. LHCC's mission is to build healthy, thriving communities by mobilizing them to develop and implement policy, systems, and environmental changes and fight tobacco and obesity. We do that by providing state leadership and resources, communications, an annual summit where people learn, share, and get inspired, and last but not least, small grants for groups to create the change in their community they want to see. Join us. To learn more, go to healthylouisiana.org. Tobacco and obesity are our biggest killers. Tobacco and obesity make it harder for the body to defend itself. The problem with tobacco is that nicotine is highly addictive, and tobacco companies systematically and deliberately target vulnerable people. Sugar, fats, and processed foods are also addictive, and these food companies also target vulnerable people. In certain neighborhoods, it is hard to access fresh, quality food, and there are limited opportunities for physical activity. The good news is communities can change these conditions by making the healthy choice the easy choice. When things are easy, or people do things by default, it becomes the norm, not the exception. That's why the Louisiana Healthy Communities Coalition, LHCC, supports policy, systems, and environmental changes, known as PSC, to make sure improvements work and that they will last. For example, smoke-free policies mean tobacco users smoke less and non-smokers are protected too. System change happens when a farmer's market gets a SNAP card reader, so lower-income people can buy produce there, which also helps food producers increase their bottom lines. Environmental change happens with Complete Streets ordinances, so every form of transportation, not just cars, get counted in new infrastructure. Crosswalks, bike lanes, and public transit shelters means everyone can get around to jobs, healthcare, and recreation. Property values even tend to go up. These changes build communities, improving quality of life and health, and literally save lives. That's why the Louisiana Healthy Communities Coalition is here. LHCC connects groups.
Good afternoon, everyone. Welcome to the LHCC World Summit. We had a poll question in the chat. And the question is, what are you hoping to get out of today's summit? And you're welcome to answer in the chat, and we will read these responses. The responses are anonymous, so you can put whatever you wish. If you came in before the meeting started, you saw some videos from LHCC, and they were produced for LHCC specifically. And our own Jamila Freitman, one of our state team members, is the voice that did the voice award. So thank you to Jamila for that. So we will be getting started. Brittany, can you share the poll again or put the question in the chat again?
The poll is up. If your Zoom is not updated, you may not have the option to answer the poll. You're more than welcome to share your answers in the chat if you don't see the poll.
Thank you. So, pre-meeting activities, hope you enjoyed the videos that will be available at our website. All participant lines are muted as you enter and will remain muted. I think there is also a closed third-party option that you can turn on. Is that correct, Brittany?
Yes.
Okay. So again, there is the poll question. What are you hoping to get out of the summit this year? And so you can place it in the chat if the poll does not show up for you. All right, so we'll get started at 1:30. Welcome to the 2022 LHCC Annual Summit, presented by LHCC with funding with Louisiana Campaign for Tobacco-Free Living, Centers for Disease Control, and Louisiana Cancer Control Program. The theme this year is Advancing Social Solidarity and Health Equity, the Power of Community Unity. My name is Jamie Bruin. I am the Senior Regional Manager for Louisiana Campaign for Tobacco-Free Living. And also I serve as the co-chair for the Louisiana Healthy Communities Coalition, alongside with my colleague, Brittany Nelson.
Good afternoon, everyone. I'm Brittany Nelson. I am co-chair along with Jamie. I serve as the Program and Policy Coordinator with the Louisiana Cancer Prevention and Control Program that is housed at the LSU Health Sciences Center in New Orleans.
So each year we host the annual summit, and it's hosted by a region that has been doing a lot of work in the healthcare arena. We want to showcase that work. And so this year we are focusing on Region 6, or Central Louisiana, better known as CEMLA, any of those names. And so that is the region that we're focusing on for this year's summit. And I will introduce you to Jennifer Gilchrist, who will introduce the welcome address.
Good afternoon. Thank you for joining us for the annual LHCC statewide summit featuring work in Central Louisiana. My name is Jennifer Gilchrist, and I am TFL Regional Manager for Region 6. We are glad to share welcome messages to you from 5 of our comprehensive smoke-free municipalities. Alexandria celebrating 10 years, Cheneyville 8 years, Glenmora 5 years, LeCount 5 years, and Boyce 3 years. Thank you to these communities for making your community healthier for all.
Are the slides stuck? Okay.
Hello, I'm Mayor Jeff Hall of Alexandria. Welcome to CINLAW and to the Louisiana Healthy Communities Coalition Conference. We're proud to celebrate 10 years as the first comprehensive smoke-free city in the state and hope you come and visit us in the heart of Louisiana.
My name is Derek Johnson, Mayor of Cheneyville, Louisiana. Welcome to CINLAW and to the Louisiana Healthy Communities Coalition Conference. We are proud to be one of 9 comprehensive smoke-free towns in central Louisiana and hope you visit us in Cheneyville the last weekend in October for our Founders Day Festival.
Welcome to CINLAW and to the Louisiana Healthy Communities Coalition Conference. We're proud to be one of the 9 comprehensive smoke-free towns in central Louisiana and hope you come visit our wonderful little town. If you're able to swing by, get a burger at Fuzzy's Restaurant, or maybe find an unforgettable item at one of our shops on Main Street, or just take a look at the old Art Deco Pringle Theater. Hope to see you soon.
I'm Mayor Craig Phillips of LeCount. Welcome to CINLAW and to the Louisiana Healthy Community Coalition Conference. We are proud to be one of 9 comprehensive smoke-free towns in central Louisiana, and we hope you come visit us, the pie capital of Louisiana.
Hello, I am Mayor Alma Moore, Mayor of the town of Boyce, Louisiana. Welcome to CINLAW. Welcome to Louisiana Healthy Communities Coalition Conference. We are proud to be one of 9 comprehensive smoke-free towns located in central Louisiana. I would like to invite you at this time to come and visit us at our Red River Waterway Recreation Area, where you can picnic, you can boat dock, and you can fish. So please feel free to come and visit us at the Red River Waterway Commission.
Thank you again to these mayors for creating healthier communities for all. We will now hear words from the co-chairs. First, we have Jamie Bruins Cyprian. Jamie is the senior manager with the Louisiana Campaign for Tobacco-Free Living, a program of the Louisiana Public Health Institute and the Louisiana Cancer Research Center. Jamie graduated magna cum laude with a bachelor's degree in psychology from Grambling State University and recently completed her Master of Public Health degree from Columbia Southern University. She currently serves as co-chair of the statewide Louisiana Healthy Communities Coalition. She also serves as a co-chair for the Region 9 Louisiana Healthy Communities Coalition. Jamie has been married to Audrey Cyprian for 12 years, and they shared 3 beautiful children, Amorn, Ajaya, and DeAndre, and of course, a rabbit named Trixie. Outside of work, she enjoys reading, writing poetry, watching television, game shows, and listening to music. One of Jamie's personal goals is to become proficient in Spanish as a second language.
Thank you, Jennifer. And thank you for not forgetting about my rabbit, Trixie. So a lot of you this may be your first introduction to LHCC or the Louisiana Health Communities Coalition. So I just want to briefly talk about LHCC. LHCC mission is to support healthy, thriving communities by mobilizing them to develop and implement policy systems and environmental or PSE changes. And 2 of the most prevalent diseases in Louisiana are tobacco use and obesity. So those are pretty much our focal points, but we also do other public health focuses. So what is LHCC? Louisiana residents experience high rates of obesity and tobacco use. And so we provide a network that helps unite, train, and support communities through, we have a statewide leadership group that meets bi-monthly. We also have local LHCCs in each of the regions. Most of those will be on this call. And also invite you to put in the chat if you need a contact for your LHCC, and invite those who know the response to go ahead and chat back. We want this to be engaging and for everyone to get something out of it. We also provide communication support, community grants, and our hosting this annual summit is to highlight those efforts that are going forward to address those chronic diseases that we have mentioned. So the theme of this year's summit is advancing social solidarity and health equity, the power of community. Along with highlighting the local and state work being done, we will also hear from a national speaker, health equity innovator and champion. Throughout these couple of years in Louisiana, we have experienced many traumatic events, from COVID to natural disasters, racial upheavals, which have highlighted many of the disparities that we continue to face. And so it is my hope that this summit will serve as a bright light in the fight to improve the health of all Louisianans. I will now turn it over to my co-chair, Brittany Nelson, for her remarks. First, let me tell you a little bit about Brittany. Brittany Nelson has 10 years of public health experience, from food safety and regulatory work to harm reduction in opioid and substance use to community engagement and health promotion. Brittany is currently a program and policy coordinator in the Louisiana Cancer Prevention and Control Program at the LSU Health New Orleans. Brittany works to promote cancer screening and prevention, as well as the implementation of policies that increase access to quality health care. Ms. Nelson has a Master of Public Health with a concentration in behavioral science and health education from St. Louis University. Brittany is an alumna of Tuskegee University, where she studied animal veterinary sciences. I present to you my co-chair, Brittany Nelson.
Thank you, Jamie. And I just want to thank you all for participating in our summit this afternoon, and the conversation around advancing social solidarity and health equity, and how the power of community unity can work. We've had close to 200 participants sign up for this year's summit. And at this summit, we'll be able to address obesity prevention, implement policies to enable smoke-free environments, and how we can do that from support in our communities. Again, thank you for attending today, and I really look forward to this discussion. I will turn it back over to Jamie to introduce our speakers.
Thank you, Brittany. I was on mute, apologies. So next we have our speaker, Dr. Earl Nupcia's Benjamin Robinson, and he will talk about tobacco and health equity. Dr. Benjamin Robinson leads Louisiana Public Health Institute's Tobacco Prevention and Control and Louisiana Campaign for Tobacco-Free Living. Prior to this, he developed and served as director of Louisiana Department of Health's LDH First Health Equity Office of Community Partnerships and Health Equity, and led the development of LDH's first agency-wide health equity plan. Dr. Benjamin Robinson is also faculty at Xavier University's Public Health Science program and has been an adjunct associate professor at Tulane University School of Public Health. He has over 20 years of public health experience working extensively in tobacco prevention, HIV and AIDS, health equity, and community and population health. Dr. Benjamin Robinson is a board certified public health practitioner, National Board of Public Health Examiners, and he is a doctor of science. You have the floor, Dr. Benjamin Robinson.
Thank you. I can't share my screen, so you may have to pull up the PowerPoint for me, Jamie. So I hope you guys are doing well this morning, this afternoon, and are feeling good. Summer is on its way, and so I'm excited about that. And I know that many of you have some religious activities that you'll be participating in this weekend. So I'm glad to see all of us will be just busy over the weekend, enjoying ourselves. And so the first thing my conversation is going to talk about, I have 10 minutes to talk about tobacco and health equity. And so the first thing I want to say is that health equity is about, for me, it is about intentionality. And it is about knowing that we, all of us, are having different experiences in the communities, in the regions, in the environments that we live in. And so as a public health practitioner, it is very, very important to me to understand that poor people are having different experiences as it relates to achieving their optimal health outcome. That people in certain metropolitan areas may be having experiences in achieving their health outcome. That people with behavioral health issues, persons of color, African Americans, Latino Americans, Asian Americans are having different experiences. That people who do not finish high school are having different experiences. All of these things have to be taken into consideration when thinking about public health work, but given my point of reference, tobacco, all of those things have to be taken into consideration when thinking about how do we serve and support people in achieving their optimal health outcome. And so for me, I start with understanding that we are not all having the same experiences. And so that then leads me to understand that there's a need to understand what are the experiences that people are having, and then use that information to inform the work that I do so that we can do, to the best of our ability, create public health, in particular, tobacco prevention and control programming that is meets the needs of the people where they are, so that we aren't just creating cookie cutter approaches. Because sometimes cookie cutter approaches can lead further to health inequities and result in health disparities. So we're not all having the same experiences, and we don't all get an opportunity to get the same resources. And so those things are vitally important in our fight to reduce obesity inside the state of Louisiana, and also in our fight to help ensure that people are aware of the cessation resources if they're interested in quitting tobacco. And that's important because about 70% of people who smoke are interested in quitting smoking. So understanding that we're not all having the same experiences and using that information to inform our work is one of the most important things that we can do when trying to create programs that are centered in health equity. And so that's why I'm using this picture, just to really bring home this point of the need for us to understand the importance of not coming from just a cookie cutter approach, but really trying to the best of our ability to do assessments that help us to understand what people are experiencing, what people are going through, and using that information to inform how we create services and programmings to better meet their needs and prop people up to be the healthiest and the most well that they can be. Second slide. And so inside TFL this year, one of the first things, as the new director of TFL, one of the first things that I wanted to create was an infographic or a document that helped us and community to understand all of the ramifications of tobacco use, so that, you know, when people are talking, when we're talking with individuals, we're able to provide information to them in a way that allows them to hear messages. We know, a lot of us working inside, or who've been working in public health or working inside public health, know that for many people, people are just trying to live. People are trying to live day to day. They're trying to survive. And so to have these discussions around policy changes or health promotion specific to obesity and tobacco, it may not be a priority in their life because they have other things that they need to be focused on, or they have other priorities that are taking precedence over the things that we know can help to improve people's lives. And so we created this document, Tobacco Use and Other Communities, and our communities, to help ensure us in making certain that we, as individuals working inside tobacco prevention and control, are aware of all of the factors that are related to, directly or indirectly, to tobacco use. And so in this document, you see that we've outlined some structural determinants of health that lead to social determinants. And when I say structural determinants, I'm talking about those determinants like policies, those determinants like resources, those determinants like privilege that affect where people live, that affect where people play, that affect where people pray, and that affect where people eat, which are what we call social determinants. And so structural determinants, social determinants, all play a part in tobacco use. And as a result of that, that tobacco use can thus have huge impact inside our states, because what we know is that though presently 2020 data indicates that 18.3% of Louisianans smoke, when we look at the healthcare costs of many of the individuals that are smoking, it costs the state an enormous amount of money. And so we also know that individuals that are smoking, those individuals are the persons that carry a significant burden of that are individuals that, and due to stresses, because many of these individuals are vulnerable populations that experience tremendous amounts of stress inside our society, many of the people who are the remaining smokers are individuals who are living in rural settings. They are lesbian, gay, bisexual, and questioning Louisianans. They are individuals who have 2 or more chronic health issues. They are Louisianans who did not finish high school, and they come from many groups like African Americans, like Asian Americans, and Latinos. And so these are, tobacco use is not happening in a vacuum. And so these are many things that we need to be mindful of that can help us to see how we might need to be creating services to better meet the needs of the people. And so I am excited to be here with you guys today. I'm excited of the work that Louisiana Healthy Community Coalitions are doing, helping to counter, one, obesity and tobacco use, but also to counter those priorities that the communities hold up and say, hey, I want to focus on this. I want to focus on this thing in relationship to obesity and tobacco. So I applaud Jamie and her counterparts for leading this work, but most importantly, I applaud the individuals inside their respective communities that are part of these coalitions that are helping to empower communities to know that we can do something about safe streets, that we can do something about obesity, that we can do something about how tobacco products are sold in our communities, that we can do something about people being exposed to secondhand smoke in gaming facilities and bars. And so thank you to the Healthy Community Coalition for allowing me an opportunity to share some words with you about health equity. But most importantly, I want to thank the individuals who are in attendance today, who will take back what they hear today and use it within their work and especially within their communities. Thank you for having me. And I will, at this time, I'll turn it over to back to Jamie.
Thank you so much. And I know we asked you for brief comments to just scratch the surface, but we appreciate you talking about tobacco and health equity. We will have our next presenter. Well, I have to stop sharing, sorry. We will have our next presenter. And I will let Brittany introduce Dr. Holcomb.
So Dr. Holcomb was born in 1949 in San Francisco, California. Dr. David Holcomb obtained his undergraduate degree from the University of California, Davis in 1971, his master's degree from the University of Florida in Gainesville in 1974, and his MD from the Catholic University in Louvain and Brussels, Belgium in 1981. He did his internal medicine residency at Johns Hopkins Affiliated Clinic in Baltimore, Maryland, before moving to Alexandria, Louisiana in 1986. After working for 20 years at the Friedman Clinic of Internal Medicine in Alexandria, Louisiana, Dr. Holcomb made a transition to the world of public health in 2007 and served as the regional admin and MD of the Office of Public Health for Central Louisiana. In 2016, he was briefly appointed the Assistant Secretary for the Office of Public Health for the Louisiana Department of Health and Hospitals. He and his charming Belgian wife, Nicole, have raised 4 sons in Alexandria, where they participate actively in the cultural life of the community. Besides practicing public health medicine, Dr. Holcomb is a painter, published writer, and folk dance instructor. Dr. Holcomb.
Can you hear me?
Dr. Holcomb, I think
Okay,
you're
yes.
on mute.
Yeah, I was muted. Can you see the slides?
I think that Jamie, you'll have to stop, or Natalie, you'll have to stop sharing.
Yeah.
Dr. Hope, are you sharing your slides? Because
I am, I said
Okay.
it's screen sharing. Yeah.
All right.
Can you see that or not?
Yes, we can see it.
All right. So I'm supposed to be in slide share mode. If I'm not, that's okay. Anyway, so I only had 10 minutes, which is to talk about the state of the state in central Louisiana, which is of course impossible. So in fact, I have to finish by 2, so that means I actually have 5 minutes. So I'm going to try and compress a complicated subject into 5 minutes. So this is a famous quote from William Faulkner that says, "The past is never dead, it's not even past." And I think you have to put all of healthcare in Louisiana in that context. And on the left side, you'll see the counties, parishes at the time with high percentages of enslaved populations in 1860. And on the right side, you see the current, actually there's 2022, which will come out in a few days, parish health rankings. As you can see, those almost perfectly superimpose. So we're talking about 160 years plus, and we have not made significant changes in a good percentage of our population in strategic areas, notably central Louisiana. So we track these things all the time, and these are our county health rankings. And remember, put this in the context of Louisiana health rankings, which are actually we're 50th out of 50 and have been so 48, 49, 50 for the last 20 years. So what's striking is not how much things change, but how much things have not changed. Now, we've only had a couple of parishes that have changed a lot. Grant seemingly has changed quite a bit, Rapides quite a bit. These are, you don't want to be high, you want to be low, because this is your percentage of your health ranking. So these are running in the 60s out of 64 parish. That's not good. So we have these 3 parishes, which happen to be, you saw in the other map, places where they had high enslaved populations in 1860. And then Grant Parish has improved quite a bit, but there's been huge demographic changes there relating to shift in population, and Rapides, unfortunately, has risen in the ranks, which is not the right direction. So if you go back to something we've used extensively in the context of the COVID and COVID vaccination, is this concept of social vulnerability index. And it's a mishmash of a lot of things, but it includes notably socioeconomic status as one of the primary indicators. And all those little pink spots are the worst areas. And if you go here, you see that those areas are in these dark areas, and these are high social vulnerability indices. So even though your parish may be doing okay in the rankings, there are parts of your parish that are probably not. So when you take this whole area, we're still at a 22 or 23,000 per capita income, which is half national average, and about 15% college graduates. And those are the 2 principal determinants of health. And so it's not surprising that our health statistics are unfavorable. So again, there's 20% below poverty level. This is the high areas of poverty and the high areas of low educational achievement. And these also run along these parish, river parishes, and also concentrated up in Northwest Louisiana. There's a strict correlation between all this. And of course, this just shows that a lot of the children in poverty, and that you have the parishes go across horizontally. There's more Black than Hispanic than white. So that's bad. And during these last few months or years actually, when they had these child credits, it lifted millions of children out of poverty. But those child tax credits are all ending. So we can expect a return to poverty. I'm trying to jam an awful lot, but I'm just hitting some highlights. Cenla has particularly high levels of syphilis, notably congenital syphilis. Louisiana is, always in the top 5 for these diseases. This has been a real problem, and unfortunately tied up in the next thing I'm going to show you, which are drug overdoses. So this COVID era has just really amplified all kinds of medical problems in Louisiana, in central Louisiana, and in specific neighborhoods. And so if you just look at Rapides Parish, this is the drug-related deaths in various years here, and you see that the last one, there's 72 deaths, which is almost a doubling of what we've been running. So this has been a tragedy. And this may seem a little disparate in far as what I'm touching on, but if you see here, those counties we talked about that were high percentage of enslaved persons in 1860, the lowest of our county health rankings, happen to be, not surprisingly, those places where there's the least access to broadband, which made a huge difference in the COVID era because of the dependence on at-home learning, virtual learning. So all this also played out in our vaccination rates, which regrettably remain about 44%. And what we saw over this period was the vaccination rates increased less in the Black population than the white population, and that crossed in November of 2021. So the Black rate of vaccination actually exceeds the white. You say like, oh, that's like interesting. But what this has done is this has actually had an impact on life expectancies. And life expectancies in Louisiana in general, in the United States in general, have actually dropped over the last 3 years. And that drop has, in this last year, been more pronounced in a white population than in the Black and Hispanic population. In the beginning, it was just the contrary. So Central Louisiana has the same kinds of problems everybody else does. It just happens to be poorer, less educated, and sicker. So these are all generated by and persistently create disparities, of which we've been interested in the last 11 years in our Disparities Forum. So that was a lightning trip through Central Louisiana, and I will conclude there. Thank you.
Thank you, Dr. Holcomb. And be reminded, we will see Dr. Holcomb again in the panel discussion later today. So that was a lightning flash, and we appreciate you being able to do a brief overview of the state of the region for Region 6. So now I will introduce, Brittany will introduce our speaker, our keynote speaker.
All right. Trying to get my screen back together. So our keynote, I'm really excited to introduce our keynote speaker, Krista Hobbs, who is a senior level public health professional with experience in epidemiology, public health program evaluation, public health program development and implementation, and partnership development. She's proud to champion the advancement of health equity and believes in the value of implementing epidemiologic principles for the design, implementation, and management of evidence-based public health interventions. Kristen earned her Bachelor of Science in Biology and Chemistry from Texas Women's University and her Master of Public Health and Epidemiology from St. Louis University. Before joining the National Minority Quality Forum Center for Sustainable Healthcare Quality and Equity, NMQF or SHC, Kristen worked at Susan G. Komen headquarters as a Senior Manager Health Equity Initiative for the Health Equity Initiative. She served at Komen for 5 years and held varying roles as an evaluator and subject matter expert in the development and implementation of the initiative. Prior to Komen, Kristen worked with the Institutional Review Board and Institutional Animal Care and Use Committee of St. Louis University on accreditation efforts, survey development, research, and analysis. She also worked for the St. Louis County Department of Public Health's Communicable Disease Control Services Division to evaluate and monitor the department's perinatal hepatitis B program, conduct epidemiologic and surveillance of infectious diseases, and refine behavioral health marketing messages for STD prevention and awareness in North St. Louis, Missouri. During her graduate studies at St. Louis University, Kristen conducted several public health research studies aimed at assessing the disparities in genetic testing within the African American community of St. Louis, Missouri, analyzing the correlation of health education and asthma management plans for prevention in adolescents, and defining predictive tools for the epidemiologic surveillance of influenza. In addition, Kristen brings unique experiences in pharmaceutical business analytics, emergency medicine, and research to NMQF SHC. In the little spare time she has, Kristen enjoys spending time with her superstar 3-year-old and wonderful husband. She enjoys writing poetry, reading, and music. Kristen?
Hello, thank you so much, Brittany, for that beautiful introduction. I am so honored and humbled to be here, sharing with you guys today as your keynote speaker. Please let me know if you have any trouble viewing my PowerPoint. But yeah, I am Krista Hobbs, Senior Project Manager of Quality Improvement and Equity at the National Minority Quality Forum, Center for Sustainable Healthcare Quality and Equity. Please just say NMQF SHC, you have my blessing. That is the acronym that we so lovingly use at our firm. I, again, am so thankful to be sharing this space with you guys today. I can't tell you enough how much it means to be doing this work on a national level and then bringing it to a local focus and sharing best practices and really learning from you guys. So I hope that not only will I be able to share what we've done, but that you'll be able to give me some suggestions and we'll be able to learn from one another. So when I was thinking about what to talk about today, I really wanted to coalesce around how we have at NMQF and SHC begun to advance health equity and solidarity via champion empowerment. We have developed what we call our Health Champions program. It encompasses several different projects and different aspects of our work. And it really serves to do exactly what this summit is for this year. So again, thank you for the invitation, and I'm so excited to be here. So I will give you a little bit of background about NMQF and SHC. I'll talk about what social solidarity is and how we have built health champions at NMQF and SHC. And then I'll tell you a little bit about our Health Champions programs. So our Champion Collab, which Brittany Nelson is a part of. She is an amazing member and we value her expertise and input so much. Our Hair Wellness Warriors project that we've expanded with Dr. Stephen Thomas, who I think you're already familiar with. Our Faith Health Alliance program, and then I'll leave some time for Q&A. Also, when I was building this presentation, I really wanted to really coalesce around what it means to have social solidarity in Black and Brown communities. And the themes that kept coming to mind were those of James Baldwin and how he really framed the existence of Black people in the United States, and how we have always been able to face what needs to be changed when no one else around us seems to want to face what needs to be changed. I know you have probably, a lot of you have probably seen one of his more famous interviews where he says, "It's taken my father's time, my mother's time, my brothers, my sisters. How much more time do you want for your progress?" And I think for us as representatives of the community, we see these changes in real time and we see what needs to be changed in real time. And so the foundation really of my presentation is understanding, again, not everything that is faced can be changed, but nothing can be changed until it is faced. And I think once everyone around our communities that have been historically excluded are ready to face what needs to be changed, we'll have social solidarity outside of our communities as well. So NMQF was founded by Dr. Gary Puckrin in 1998, really to address the critical needs for not only strengthening national efforts, but on a local, so state, city, and county levels, using evidence-based, data-driven initiatives to decrease disparities, advance health equity, and reduce patient risk. So the crux of what we do at NMQF is use data to advance health equity and reduce patient risk, especially for historically excluded populations. And so at SHC, we use those data to build sustainability and build healthy communities in every single zip code. It's always a lofty goal when I say in every single zip code, but that's really our aim. How do we build sustainable processes, sustainable systems, and sustainable partnerships that seek to advance health equity in Black and Brown communities, historically excluded communities in every single zip code? Again, we prioritize communities of color, but we also work within rural communities as well. Our interventions are really laid on the foundation of quality improvement in clinical education through a lens of health equity and public health interventions. So we have clinical quality improvement projects that span the gamut of therapeutic areas. We work in prostate cancer, lung cancer, diabetes, heart failure, atrial fibrillation. And then our public health interventions really focus on vaccination uptake and improving vaccination uptake in Black and Brown communities. And that's where our Health Champions program has really been built from. We are led by Dr. Laura Lee Hall. You know me already, and my colleague Chinonso Ukachukwu, who she prefers to be called Chinny. She is our Quality Improvement and Equity Project Manager. So what is social solidarity and how do we leverage it to advance health equity? Social solidarity is really the interdependence of communities and how we empower one another to improve our state of being, whether that's health justice, environmental justice, economic justice, and the like. It really has a basis of shared values and shared beliefs amongst the community and says we're in this together. So how can we move toward a common goal and a common agenda by being in this together? And it respects the fact that we are all not a monolith. Just because we belong to a certain subpopulation of people. And we have to respect that. I think that's one of the things that we do really well at NMQF and SHC is understanding that intersectionality exists, but intersectionality can be a springboard and hold space for social solidarity within the community. For example, as a Black cis heterosexual woman, I can still be in solidarity and advance health equity and hold space for Black, trans, homosexual, heterosexual women as well. And I think that when we continue to think of ourselves or we continue to allow others to think of our communities as this sort of flat plane or monolithic entity, then we miss a lot of the nuances that come along with being in community and furthering and advancing health equity. because everybody has different needs, and equity literally means giving everyone the shoe that fits them and works for them, not giving everyone the same shoe. And another thing I think that's vitally important for social solidarity, and something that we have really built the foundation of our Health Champions program on, is shunning respectability politics. I think building social solidarity means that not only is it just that all are welcome, right? But it means that we don't create rules for how people engage in healthy behaviors. We really seek to change the systems in which people have to navigate and have healthy behaviors. And those healthy behaviors can exist. And then lastly, understanding and holding space for mistrust. One of the things that I've known throughout my career, and I've been able to validate at each stage of my career, is understanding it's not enough for me to know the historical injustices that have been committed on the bodies of Black folks and brown folks. It is more important for the people that I serve today to be able to have space to still mistrust the system. And in some spaces, mistrust me, because I am a public health professional, so I am a part of a system. And being able to vent, being able to have ideas, being able to say I still mistrust, but I'm going to try out that vaccine if you're telling me that it's going to decrease my risk for complications, hospitalization, and mortality. And so when we get there and we don't have to come to people with a solution, but we allow them to give us a solution, then we're truly sharing power. And that's where we come and we try to reverse a lot of the tokenism that happens in public health, and a lot of the things that sort of, shun social solidarity. When we're building social solidarity, we need to not only share space, but share power. And that's not just say the power to ask questions and the power to share ideas, but the power to say no, the power to engage in the evaluative process, the power to engage in fiscal responsibility and shelling out the dollars that need to be distributed amongst a community. And that has been a real game changer for our Health Champions program. We're not only seeking out the advisement of community leaders and stakeholders and community members, but understanding that they too are leading the initiative. One of the things that I'm getting away from is saying community engagement. A lot of the communities we work with have said, engagement kind of lends to this, you gave me a ring, but I don't really know if you're going to commit. Let's talk about community marriage. Get me all the way down the aisle and make that commitment. I want to be an integral part of the process. And that's something that we've always known in public health, but I don't think a lot of institutions and entities really get what that means to share space and power. So how have we built health champions at NMQF and SHC? So first, what is a health champion? A health champion is literally anyone who has the determination and enthusiasm and passion to address the health needs of their community. So we engage clinicians, but you don't have to be a clinician. We engage public health experts, but you don't have to be. You could be a teacher, but you don't have to be. You could be a volunteer at a community organization, but you don't have to be. You could be a pharmacist or a barber or a stylist, but you don't have to be. It's literally anyone who really, really wants to change the system upstream instead of always talking about the behaviors of people. And who do we engage? Again, people passionate about improving health in their communities. We do this through evidence-based public health and clinical interventions and communications interventions. Why do we do this? So NMQF Health Champion Program, again, was developed around vaccination uptake, but also to expand upon and really tackle the pervasive inequities that are plaguing communities of color. So how do we do this? These are some of the examples, but really our health champions could span the gamut of what they do. We talk about quality improvement and clinical interventions, really having a marriage between the clinic and the community, marrying public health advocates and patient advocacy organizations with clinical and health systems to improve health outcomes through quality. Community engagement. So what does that look like? Does that mean that we build education programs with a community and around that community. Public health interventions, so holding vaccine clinics, communications campaigns, having webinar series, PSAs, social media series to really help people share information on their own platforms. So it really could span the gamut, and we are always taking all callers. So if you want to be one of our health champions, please do let me know. So the first part of our Health Champion program, our Champion Collab, this is something that I lead. Again, Brittany is a part of it. It's a collaborative of super champions, is what we like to call our collab members, for building an ecosystem that will seek to advance health equity in historically excluded communities. We have public health professionals, clinicians, medical students, community engagement folks, hospital administrators, communications folks. And really, this was birthed out of the need to get out of our silos. This is a group of people who are already doing this work and doing it really well, but they're doing it at their own organizations. So how do we bring all of those resources, all of that knowledge, all of that brain power together in one space and help each other and further the advancement of health equity for whatever that means? So we've started with vaccinations, but we're moving to a total health approach this year, and we're calling that approach the Champions for Total Health. The CoLab and NMQF and SHC have teamed up with the Association of Immunization Managers and their iReach program to develop this entire webinar series that focuses on the intersections of vaccinations and total health. One of the things that we've always known, but the pandemic has shown us without a shadow of a doubt, vaccinations are not the only important thing when we talk about total health. Black and brown communities were consistently messaging to us throughout our vaccination campaigns. We had issues and we had disparate health outcomes before the pandemic. We have them during, and we will have them after. So how can we really trust you if we think that you're only here to give us a vaccine because the disease that the vaccine targets could make white people sick? How do we actually build and maintain trust with communities if we're only there when there's just that one emergent need? And so we're focusing on total health in this webinar series, and each month we'll have a different focus. We have already done chronic kidney disease in March. This month will be about Black maternal health and vaccinations. May will be mental health. June is cancer. July, health and wellness. Both August and November will be about diabetes and cardiovascular disease, because both of those months have really big implications for both of those chronic diseases. September will be healthy aging, October lung disease, and then December HIV and AIDS. The really neat thing about this webinar series is that it's interactive. Each webinar is interactive because we're also building a microsite for each of these total health areas at the intersection of vaccinations that will also inform infographics and social media graphics and printables that can be distributed for education in the community. And so during the webinar, the panelists include a specialist, a vaccinologist, and a patient within that area. And the panel and audience have an opportunity to give us feedback so that we are building the most culturally appropriate and culturally responsive microsite, which, if you don't know what that is, it's a one-page website embedded within another website. But really making sure we can build something culturally responsive for people of color and have real-time feedback, and especially having that patient voice. So we're really excited about this webinar series and to keep it going and kicking it off. And you've already heard from Dr. Stephen Thomas, who is an incredible partner with his Health Advocates and Recent Research program. We have expanded that program and we are calling it the Hair Wellness Warriors. For the last, I want to say 6 to 7 months, we've been working with 10 barbers and stylists across the U.S. to do flu vaccination education and clinics in their barbershops and salons. And this year we will be expanding those efforts so that we recruit more barbers and stylists for that initiative. Some of the flu vaccine activities that the barbers and stylists engaged in, some of them partnered with their local departments of health, health systems, clinics, or clinicians that they do their hair for or that they have an already existing partnership with to hold vaccination clinics. And then all of these interventions included the distribution of educational flyers to their clients, to their communities, to their staff that have these unique QR codes where people can scan those codes to then take them to additional information about influenza and flu vaccinations. Other barbers and stylists engaged local vaccine experts on flu and flu vaccine education. And so really bringing somebody virtually or into the shop to give education to their staff and their clients, also distributing those flyers. And then others held hybrid educational and vaccine clinic events. Miss Sandra Lee Jenkins is pictured here. She actually created a Wellness Warriors area where she will be distributing health information and education and referrals where people can get vaccination or other screening services throughout the life of this program. So we will be expanding beyond vaccinations to diabetes this year. And then we developed a certificate program for their staff to receive education on all of these projects, all of these therapeutic areas and become certified. And then in terms of communications, there were some barbers and stylists who held who did PSAs and spoke with some of their leading community leaders and vaccine experts to really share and disseminate information online. And so it's been a fantastic ride with the Wellness Warriors. And then the Faith Health Alliance, my colleague Chinny leads this effort. It is an amazing effort to engage a network of churches across the nation. I think that number has actually increased from 14 to 15 today, actually, serving the Black community and really being ambassadors for health. Again, we know Black communities bear the brunt of health inequities, and the Black church can be a vital way to promote health. We also want this to be an area where we springboard outside of the Black Protestant Christian church. We know that across the country, Black people engage in faith in a lot of different ways. There are Black people practicing Islam, there are Black Muslims, there are Black people who practice Catholicism. And so we know that this can be a springboard to really begin to engage and have community marriage, if you will, with other faith-based organizations and other clergy leaders. So we're looking to continue expanding this work in 2022 beyond flu vaccination activities. Lots of our churches are really focused on mental health and wellness. And so we will be engaging a well-known COVID-19 expert pretty soon to host an informational session for all of the churches that are engaged in our Faith Health Alliance around mental health and really how to move forward. And I'll leave you with this before we take questions. There really can be nothing about us without us. And I think that's the crux of social solidarity and advancing health equity, is that we have to be a part of the narrative, understanding the intersectionality and having those shared beliefs. We can empower one another to advance and achieve health equity. So thank you.
Thank you so much, Kristen. We'll go ahead and use the chat for questions. V, we can share the coalition information in the chat. I believe Jamie has the text together.
Yes, and also while we're doing that, I can start. Brittany and I, we talked about when we heard about you saying instead of it being community engagement, community marriage. Mm-hmm. And so that concept, can you talk more about that?
Yeah, absolutely. So I think a lot of times we as public health professionals have used communities, taken advantage of communities We don't pay people enough to engage in all of these projects and lend their expertise and make sure things are culturally appropriate and culturally responsive. And so that lends into them not having power to be able to say no. And that power dynamic further creates inequities, because if I can't say no to the person who's giving me funding or the people who have the power to help me change my health outcomes, then, and I don't have a stake in the evaluation process, or I'm not involved in the planning and the development of any of these initiatives, then how do we create real, lasting, and sustainable change, right? The community needs to be integrally involved in that. And I think in a marriage, when we talk about a good marriage, I feel like I'm in a good marriage, if I can say so myself. You're in a partnership, right? We fill in the gaps, and everybody has a stake in the success of the partnership and relationship. And so being in community marriage versus engagement shows a further commitment. And it's a testament to even changing our language and how we talk to communities as well. And also, if you do want to become a health champion, you can email me. I'll put my email in the chat.
So there's a question from Cheryl Sutton here. Dr. Holcomb pointed out we have ranked 50 out of 50 for 20 years. What about the years before that? Was there something that worked? Was there something different, or have we noted anything that worked? So I think with that question, let's see. What are some techniques that are working to, increase vaccine uptake, address some of our most prevalent health issues in our minority and rural communities? What are some, I guess, like, what are your top 2 or 3 or 5 things that are going well to address health issues?
So I will say going upstream instead of downstream. I talked a little bit about this, but downstream public health interventions say we are going to try to do everything we can and apply all of our behavioral theories to improve your behavior. And what we miss are the social, political, and systemic determinants of health, right? The social, where people live, work, eat, play, and pray. The political, the state, federal and local laws that really govern how these inequities have come to be over the last 400 some odd years. And then the systemic determinants of health, the systems that operate within the social and within the political determinants of health also create their own policies and their own structures. So every health system has their own policies and their own structures that they have to reckon with as to why those disparities are continually perpetuated amongst their patient population and their community. So for us, really the very first thing that has worked is intervening at the clinical level with that, again, community marriage. So the clinicians, we don't do any quality improvement without a community level marriage going on. So the clinicians have to engage with a patient advocacy organization that's representative of the community and really doing things to decrease health disparities. For instance, our prostate cancer QI work, our clinicians partnered with the Prostate Health Education Network, which focuses on improving health outcomes in prostate cancer for Black men. And so really seeking to change systems, I think, is the number one thing that has worked. And then again, the second thing, really allowing communities to lead the charge. Yes, we have expertise as clinicians and public health folks, even community engagement experts, but a community coming to us and say, this vaccine isn't my only problem. I will come get this vaccine if I can see you next week for my diabetes or hypertension screening. And that really has built and maintained a lot of trust where we may not have seen it before. I think Dr. Holcomb showed the numbers where vaccination uptake had flipped from a lot of Black people being vaccine hesitant to now being vaccinated. We've seen that in our national trends all over the country. And I really think that's because we've taken a vested interest in what is interesting and important for communities. And so those are the things that have worked tremendously for our national efforts and our work.
Thank you, Kristen.
You're welcome.
So Shauna says, how do we get the clinicians to buy into the importance of community marriage?
So clinicians, every health system has to do quality, okay? And they have to meet certain standards in order to ensure that they continue to have resources and funding resources. And so when you tap into what it is they already have to do with what their patient population and their community needs, that then gives them a buy-in to engage with communities. And then you have to get them to understand that they don't know everything. I know that a lot of community members express to me in particular that sometimes advocating for yourself can be scary because physicians have a very prestigious role in our society, and they do. But they also don't know health equity. They don't know health disparities a lot of the time. And so we have to bring that expertise. And once we partner with them and bring that expertise and then bring our communities together with them, they're willing and they're ready. And I think a lot of what we see now with physician burnout, they are really on the precipice of saying, we cannot do this without communities because we will be spinning our wheels and doing it over and over again and reaching nothing, right? So you really get clinicians to buy into community marriage by helping them understand this is already something you have to do, but here's why you want to do it. You don't want to be burnt out trying to do something that is not your lane of expertise. And we have folks who already do this really well.
So I'm going to go to Jennifer's question and then come back to Dr. Holcomb's question, because she talks about in our community work, we find that many people have deeply entrenched fears, misinformation, cultural stories, and practices that have been passed down generationally over many years. So what's the best approach to these type of obstacles? But then I also say, you know, how can we empower our community members to advocate, you know, to improve the built environment, to advocate for smoke-free environments? How can we address these issues? So a few different things to address, but you know, the main question is, what is the best approach to these types of obstacles?
Yeah, so the first thing is not seeing them as obstacles, because they're assets to our community. These are traditions, these are religious practices, faith-based practices, and even the fears, like our fears and mistrust of the medical and scientific and public health systems are so deeply ingrained in us. I learned about all this stuff when I was a kid. I'm 32 and I was probably like 7 when I learned about a lot of the injustices because we passed them down from generation to generation, like you said. So I think we need to, again, hold that space for those things to exist. So one of the things that we are trying to do when, for instance, we talk about education and diabetes is understanding that just because your cultural foods don't make it on the food pyramid doesn't mean they're bad foods. It just literally means we just need to figure out a way that you can eat that stuff and still reach your health goals and still have nutrient dense foods. There's a different way to cook it. There's a different way to engage on your plate, like having smaller portions. So a lot of the things that we have traditionally in public health seen as obstacles, we need to be embracing them as assets and then integrate them into our interventions. And that's what's vitally important for having a community leader and member help to lead those interventions and the development of them. And then I think, did I answer the other question?
I want to say yes.
Okay.
You did, absolutely. So then circling back to Dr. Holcomb's question, how can we generate or encourage the political will to address these very long-standing disparities? socioeconomic improvements are not really in the lane of public health providers. And I will add that Dr. Holcomb also said in his medical residency, or our local medical residency has refused to let us educate them about social determinants of health because they said it was too political.
Yeah, so that's the Dr. Holcomb, that's where the political determinants of health come in. So a lot of my work at Komen was really helping to build what we call the Speak Truth to Power program, but it was really focused on legislature for building health equity and advancing health equity. We have to get comfortable with training community members to talk to legislators on the Hill, but also when they're in their offices in local and state and county government. We have to get also our medical schools and institutions engaged with these efforts. So one of the things that I know to be true at the Center for Health Justice at the Association of American Medical Colleges is that they're trying to build a pipeline where all of these issues are built into the curriculum for medical students. That way it then is permeated throughout their residency, and they're building these professionals who already have this expertise once they hit the clinic and they're full-time physicians. And so it's really about how do we integrate policy and how do we continue to advocate. It's so very difficult to speak to someone with whom you don't know, right? So a lot of the times we study our legislators and understand what makes them tick. Some people want to see all of the data. They want to see, you know, every single piece of disparate data in their county for their constituents and how they can then improve health equity and how they can, you know, enact policy that affects the social determinants of health. But then other legislators love anecdotal information. So bringing them real, true to life patient stories that said, I can't go get my cancer treatment because of transportation, or this particular part of the healthcare system in my area has so much systemic bias and systemic racism. Every time I go to a doctor, I'm talked down to, or whatever the case may be. And so it's vitally important that we engage our public health folks in this political discourse. I'm not saying that everybody has to be a policy expert, but I think when if the residency refuses, it's a lost cause. Yeah, I think, you know, when you talk about the residency refusing, it also has to be tied to where their dollars come from, unfortunately. Again, even the institutions that train residents, they have a community health needs assessment and they have to get on that chip and improve the health of their patient population. And so there are lots of times where we have to appeal to that particular portion of their work.
Thank you. Dr. Holcomb also said, can you help us locally? So can you do some work in Louisiana and help us?
I can help wherever you need me to help you. Just let me know. My email's in the chat.
Well, Kristen, I just want to thank you for you know, being our keynote speaker, starting this discussion and answering our questions. We really appreciate it.
You're welcome. And thank you so much again for allowing me to share this space. You guys are doing amazing work at the Louisiana Healthy Communities Coalition. Thank you.
Thank you. All right, so I'm going to go ahead and share some of the results from the poll that we had earlier. And again, the question was, what are you hoping to get out of the summit today? So some of the questions that we had were broadening knowledge regarding effective collaboration in local and statewide coalitions, rejuvenation and ideas for getting back into the community and creating energy around healthy community work. One person said, I'm interested in networking with others in community health and to learn what health issues are being focused on in Louisiana. And then we had a first timer. So this is my first time attending the summit. So I'm hoping to gain extra knowledge and information pertaining to my Region 6. And I look forward to hearing from the guest speakers. So at this point, we will go ahead and next slide, please. introduce our yoga instructor for our active break, DJ Nico Marie.
Hey.
Hi, how are you?
Good. Can you see me?
I need to find your name so that I can spotlight you. 1 second.
Okay. It says Nico Marie.
Okay. There we go. Uh-oh. Okay. The floor is all yours.
Hi. Hi. Can you guys see me okay? Can you guys hear me okay?
Yes.
All right, so I'm Nico Marie. I am a DJ here in St. Louis. I'm a certified yoga instructor as well. My mission is to spread the knowledge and the teachings of yoga to my community, to people who it's not often marketed to, which includes Black people. So that's been my mission since I completed my training. And I host classes here in St. Louis, affordable classes for people in the community. I also have a YouTube channel, which is completely free. There's also membership options, but it's completely free. So I can reach an even wider audience. So should we jump right into a session?
Before we start your practice, let me read your bio and introduce you.
Oh, okay, cool. Yeah.
So Nico Marie is a certified yoga instructor who began teaching yoga in 2016. She has a certification in Vinyasa. She's passionate about making yoga accessible and affordable for those who may not normally be included in this practice. Nico Marie grew up in Cool Valley, a small city in St. Louis County, Missouri, right outside of Ferguson. Nico Marie describes herself as an artist because of her love for all things beautiful. From yoga to music to dancing to drawing, her outlet has always been her creativity. Nico Marie has been featured on Pop Sugar Fitness. She's completed trauma-informed training with Yoga Behind Bars, and she hosts affordable yoga classes to make yoga more accessible in a predominantly Black neighborhood in St. Louis. Nico Marie can be found on her growing YouTube channel called Black Yogi Nico Marie, and I can paste the link to your YouTube in the chat. So we're ready when you are.
Okay, it's going to be a really simple session. So whether you're just sitting in a chair, you should still be able to participate. We're just going to do some light stretches, but we'll start with some breath. So just bring yourself into an easy, comfortable seated position. And if you feel compelled to, you can close your eyes. If you want to keep your eyes open, just have a soft gaze. And we'll just take some breaths. So let's put one hand over the heart and one hand on the belly. That really helps us to focus in on where the breath is moving and incorporate some mindfulness into our practice. So you can close your eyes down or take on your gentle gaze. And we will take a deep inhale through the nose. And exhale softly out the mouth. Take a second deep inhale through your nose. And exhale out the mouth. Good. We'll take one more deep inhale. Make it your deepest inhale yet through the nose. Pause at the top and exhale fully. If you want to keep your eyes closed, you can. You can rest your hands on your knees or on your lap. We'll just move our head in some simple circles to the right. So just start rotating your head to the right side. You'll inhale as you go back and exhale as you come forward, moving with the breath. Thinking about mindfulness again. And what mindfulness does is it brings you to the present moment. It helps you let go of thoughts of the past or the future and lowers your stress level. So as you incorporate your breath with your movements, you're using mindfulness to just keep you here. giving yourself something to focus on, giving your mind something to think about other than worries or to-do lists. Let's do the same thing. Start rotating your head to the left. Intentional breaths, intentional movements. Bring your head back to a neutral position. Take your right hand, whether you're seated on the ground or if you're sitting in a chair, just press your right palm away from you. So you can just either press it away or rest it on the ground if you're able to. Drop your left ear to your left shoulder. And we're going to take our left hand, without pulling on the head or neck, we're going to gently rest our hand on the side of the head, just deepening the stretch. Taking a couple breaths here. Our hand is just being used as a weight. Take an inhale. Exhale, lower your left hand down. Drop your right ear to your right shoulder. Right hand can very gently rest on the side of the head, just being used as a weight. Take an inhale. Exhale, release the right hand. Bring your hands to your knees or bring your hands to rest on your lap. We're going to work into a little bit of seated cat-cow. So all you have to do is press your shoulders forward, round your spine, bring your chin down to your chest, pull your belly button back towards your spine. And then we're going to roll the shoulders back, arch the spine, inhale, lift the chin up towards the sky. So we'll move in and out of these two positions with our breath. So as you round your spine and bring your chin down to your chest, you'll exhale. And as you open the chest and lift your chin, you'll inhale. So just moving in and out of those two positions at your own pace. Still trying to make the movements intentional. Still incorporating your breath so that we can keep that aspect of mindfulness and staying here in the present moment. Let's do a couple more rounds of cat-cow. We'll come back to a neutral position. I'm gonna incorporate a little twist here. So inhale your arms up, interlace your fingers, press your palms towards the ceiling, reaching up, breathing up as tall as you can. Exhale, we're going to release our hands and twist towards the right side. So let your left hand come on the outside of your right knee. If you're in a chair, you can grab the back of the chair with your right hand. Or if you're sitting somewhere, you can plant your hand with your fingertips facing the back wall. And then let your gaze follow. So start to look over that back shoulder as well. Trying to sit nice and tall here. I'm gonna take one more breath. Let's take an inhale, come back to center. Interlace those fingers, press those palms towards the ceiling again, reaching up, breathing up. Exhale, twist to the left. Right hand can come on the outside of the left knee. Left hand can grab the back of the chair, or the left fingertips can come to face the back wall, and let your gaze follow. Take an inhale, come back to center. Interlace those fingers, reach up, breathe up. Exhale, release the hands. Let's just give ourselves a quick little neck massage. We tend to hold a lot of stress on our shoulders. So just take your hands, kind of make them like little cups and place them on the tops of your shoulders. And then I want you to apply a little bit of pressure as you let the hands slide forward down towards the collarbone. Or if you feel a spot where there's some particular tension, you can use your fingers to kind of knead that muscle, knead that spot. It's interesting how we can do these little things to kind of help ourselves and help us release tension and feel better, but sometimes we just need a little reminder. So if there's any spot up in your neck or your shoulders where you can give it just a little massage, go ahead and do that. Good. Let's release the hands. Extend your arms out wide on either side of your body. Take an inhale. Lift your chin, lift your chest, open the heart. Exhale, cross right arm over left. Grab either shoulder. Sit nice and tall. Bring your chin down to your chest. Getting a little bit more of a stretch in the top of the neck and the shoulders and the back. Good. Let's take an inhale, extend those arms back out wide. Exhale, cross the left over right, grabbing either shoulder, bring your chin down to your chest. Take an inhale, exhale. Let's close our session with a little bit more breath. So if you want to come back to resting a hand on the chest and resting one hand on the belly, you can. We'll just come back to those breaths we used earlier. Just calming our body down again. So take a deep inhale through the nose. And exhale out the mouth. Really feel your body relax as you exhale. Let's take a second inhale. And exhale. Beautiful. One last deep inhale. And exhale. Release any control over the breath and allow your breath to be natural. Just using your hands to feel the rise and fall of your belly and chest. Feel the coolness of your breath as you inhale and the warmth as you exhale. Then on your next in-breath, let's just wiggle our fingers and toes, being back aware of our body, coming back into the space, coming back into the room. And together we'll sweep our arms up. Inhale, let the hands meet. Exhale, bring the hands to heart center. Thank you all for sharing this space with me. Namaste.
Thank you so much.
You're
That
so
was great.
welcome.
That was
Of
the
course.
stretch that I needed. I ran this morning and didn't stretch, which
Oh.
you should not do, but.
We got it in, good.
Right. So just in the chat, we have very relaxing, thank you. Love the yoga break, great instruction. Like I said, I pasted your YouTube channel in the chat. So thank you for leading this stretch break for us.
Absolutely, thank you all. I appreciate you.
All
Thank
right.
you for having me.
Okay, so next I will introduce our panel moderator, Jennifer Gilchrist. Thank you, Natalie. So Jennifer Gilchrist is the regional manager for the Louisiana Campaign for Tobacco-Free Living, a program of the Louisiana Cancer Research Center and the Louisiana Public Health Institute. As a TFL manager for over 14 years, Jennifer has worked with community partners, stakeholders, businesses, medical professionals, and institutions, policymakers, municipal governments, and committed volunteers to promote and achieve healthier air for all. Jennifer has earned her national certification in tobacco treatment practice and is co-chair for the Central Louisiana Healthy Communities Coalition. She serves as the chair of the Central Louisiana Long-Term Recovery Group and is a Rapides Parish DARE board member. She participates in the Professional Women's Network, 100 Women Who Care, and is a parishioner of St. Francis Xavier Cathedral Church. She received her Bachelor of Social Work from Loyola University in New Orleans and her Master of Social Work from LSU in Baton Rouge. So let me stop my spotlight and there you are. Hi, Jennifer. Uh-oh.
Yeah, you ready for me?
Yes. And Natalie, if you want to stop sharing.
Hello, everybody. We are so glad you are with us for this segment of our summit, our panelist session. We are happy to introduce you to individuals who know and do work in health equity on a daily basis. They see their communities up close and personal. They collaborate with partners and serve and advocate for those who deserve a supportive voice. Each panelist will be provided an opportunity to talk 2 to 3 minutes about what rural health equity means in their work. We will ask each speaker at least 1 question, maybe 2, if time permits. So I can go through their bios. And introduce them to you. And since we already heard from Dr. Holcomb, we're going to go ahead and move forward to our next panelist, since y'all heard his bio and heard him talk. Next up, we have Kitty Wynn, who will be talking about the power of coalitions to advance unity and health. Ms. Wynn is the Director of Prevention Services for the Central Louisiana Human Services District and has served for the last 15 years as a regional prevention coordinator. She was instrumental in the development of 8 community coalitions in Region 6. She also served as the coalition liaison and technical assistant to the 8 parish coalitions that the Central Louisiana Human Services District is part of for more than 10 years. She has also served the community with drug prevention outreach and educational services. Ms. Wynn is licensed through the Addictive Disorders Regulatory Authority and has achieved her license in 2013. She has also served the district in the Addictive Disorders Clinic as a counselor in training, wherein she performed assessments and made referrals for those seeking substance use treatment. Mrs. Wynn previously served as a paralegal and has more than 20 years in the field of accounting. Kitty is married to Gary Nguyen and is a resident of Pineville. Her passions lie in the service of her community through volunteerism for the underserved. In her spare time, she enjoys cooking, gardening, traveling, golf, and reading. Next on our panel will be Reverend Roger Greene, pastor of Mount Zion Missionary Baptist Church. Reverend Greene accepted Christ as his personal savior during his youth and was baptized at the New Pilgrim Baptist Church in Woodworth, Louisiana, called to ministry in 1991 at the Second New Zion Baptist Church under the leadership of Pastor Frank Freeman. He has served in concurrent pastoral roles at Christian and Second Christian Baptist Church. In 2005, Reverend Greene was called to the Trout Creek Baptist Church of Gina, Louisiana. There he served faithfully for 8 years. On September 8th, 2012, he was installed as the proud pastor of Mount Zion Missionary Baptist Church. He is currently attending Cenla Theological Seminary, where he is pursuing his bachelor's degree in theology and divinity. His vision is uncompromisingly clear and one central principle to build and develop a kingdom empowered people for God, holding firmly to the commission mandate in Matthew. Go ye therefore and teach of all nations. As an active participant in both foreign and local missions, Reverend Greene has a tremendous passion for God's word, coupled with a love for God's people. He has a contagious spirit of generosity that flows through every facet of his ministry. Having received his mandate from God, Pastor Greene currently obediently fulfills his calling to God to preach the word of God. He is passionate about proclaiming the good news of Jesus Christ, making the world of God relevant in the lives of believers and building the kingdom of God in the congregation and community. Reverend Greene is married to the sister Carol Greene. This union has made 3 beautiful children, Roger Lee Greene Jr., Fred Shea Greene, and Laquidra Greene. And our final panelist is Dr. Alicia Cyprian, Southeast Grantee Community Center, and is one of our CERT grantees working this past year with TFL. Alicia Cyprian joined Southeast Community Health Systems as its Chief Executive Officer in 2014. Since her appointment, Cyprian has provided strategic direction for the nonprofit healthcare organization in communities of high need in 4 Southeast Louisiana parishes. She thrives on challenges, particularly those that expand the organization's reach. Cyprian is a board of director and serves as a board chair of the local Primary Care Association, a board member for the Greater Hammond Chamber of Commerce, advisory committee for the Petra College and National Association of Community Health Center, Legislative Committee and Health Center Excellence, and training co-chair. Prior to joining Southeast, she worked in higher education for 18 years as a director, dean, and assistant vice president, providing oversight of enrollment management and student finance, in addition to having principal roles in ensuring state and federal program compliance. Cyprian earned a master's degree and Doctor of Philosophy and Administration from the University of New Orleans. So we welcome all of our panelists. Now we'll go ahead and get started and address Dr. Holcomb first.
Jennifer, 1 second before we move on. Reverend Greene, are you on the line? We have one person that's joined by their phone. Okay, go ahead. It doesn't look like he's joined us just yet, but.
Okay, well, we'll just save him for last and maybe he'll be able to hop on the call for us. Yeah. Okay, Dr. Holcomb, we'll start with you first. I have a biggie for you. How does addressing social determinants of health and achieving rural health equity intertwine?
Well, as we sort of discussed earlier, the outcomes we have are health is a byproduct of social determinants of health. And so behaviors and access to medical care are actually the least part of what determines health outcomes. Over 50% of outcomes are social determinants of health. So that is your income, that's your social status, that's your educational level. And you have to address those if you want to address the outcomes. Otherwise, you're pouring your resources into an endless pit, because the roots of the problems are social and economic. And by not addressing those, we see this awful stagnation that we've seen in the many areas of Louisiana where things have not changed at all in 160 years. So you can't separate those two things. And when you try and separate them, there are people say, no, that's all politics. You can't talk about that stuff. The people who do that are actually, cutting themselves off from responsibility and from the possibility of actually making a positive difference. So hope that answers your question.
Yes, thank you so much. So I'm going to go next to Dr. Cyprian. Your question is, what are some of the challenges doing tobacco prevention work in rural communities?
Thank you so much. I have to echo what Dr. Holcomb just spoke about, though, particularly for me working in a federally qualified health center who is federally funded to provide healthcare services in underserved areas, and more so in underserved areas, regardless of those communities' ability to pay. So we offer a sliding fee scale to those communities, but when you're providing care, even on a sliding fee scale for someone who needs a medication, and someone put in the chat earlier, social determinants of health and political and social and economic avenues that are barriers to those at those levels are not just about, structural, and it's also, as they talked about with Big Pharma. So we're dealing right now, the national level, with a 340B program that provides for discounted medications for those who otherwise don't have access. So when you're dealing with a patient who is coming to seek care, who needs the medication, but who also has bills to pay and has a limited income, that patient's behavior is then to choose what's in the best interest for my family, because at some point it can't be about that individual. So I'm glad that this conversation is happening today. And with respect to tobacco prevention, and what's been talked about earlier is engagement, marriages, and in order for, particularly in rural communities with tobacco prevention and social determinants of health and access to care and food insecurities and things of that nature, the cultural aspect, as well as, when in families, particularly in rural communities where you see grandma, grandpa, brother, sister, and depending on how the family lives together, and you see those habits and those behaviors in those families, it's really hard to break those families. And it really is going to take community partnerships and collective efforts with organizations and entities like Louisiana Public Health Institute, the Louisiana Department of Health, coupled with federally qualified health centers who have intentional relationships in those communities and who develop the faith-based relationships and who are constantly in those communities, who provide the resources and who are able to provide the education and constantly provide that education in the way in which, especially a federally qualified health center is set up for Southeast as a patient-centered medical home, where we provide the patient education and will continue to do that for the patient populations that we reach. So the challenges is, people, sometimes life stressors will create habits that become very challenging and difficult to break. And some tobacco use, especially in rural communities, tends to be one of those.
Absolutely. Thank you for your comment and for your astute observation and information. Kitty, I'm going to go ahead and ask you about the coalition work that goes on in Region 6, since you are expert in that area and have many years that you've seen this work done over the last 14, 15 years. So what I'd like to ask is, what health equity gaps or issues has coalition partners been able to address through their work collaboratively over the years?
Well, I sat earlier and jotted down some of the notes that from the things that we've addressed from the get-go. As you know, we are a collaboration of service agencies and community folks, and just about every one of our parishes here that are involved in our coalitions. But we have addressed tobacco policy, healthy workplaces, multitudes of programs that have to do with health, disaster relief, domestic violence, community gardens, specific issues of health, diabetes, high blood pressure, cancer screenings, breast, colorectal screenings, smoking cessation, mental health, addiction, developmental disabilities, education, HIV, STDs, healthy lifestyles, diet, exercise, obesity, oral health. I mean, I could go on for hours of the work that we've been able to accomplish as community partners and coalition members and collaborations in this region. It is amazing sometimes, and it's actually very heartening to see when one of our coalition partners is able to have that light bulb moment in one of our parishes and have a success, and we get to share in that joy and that work success and the joy that it brings to that community to have that resource available to them and for their people of that community.
Thank you, and that is quite a handful. And to piggyback on that, I'm going to go ahead and ask you a second question. How have you witnessed the strength of collaboration and partnerships of coalition members in Region 6?
Wow, that's a big one. You know, when we first started this, there were several agencies that came together and that were being tasked with very similar work in very rural communities. And instead of us trying to work in silos and do this as individual agencies, we came together and decided to bring our agencies together. The collaborative efforts have been amazing over the years. We not only have been able to support each other in so many ways, we've had an inclusion. We have assisted each other in achieving specific scopes of work, in implementing events, in reaching people that we were otherwise unable to reach, or that we didn't know that we could reach through our relationships that we had in those communities. We have represented each other at events and at meetings and spoken up for one another, and the work that we do. We've made referrals to each other as agencies and for information. We reach out to each other constantly for information or ideas or resources that we may not always be thinking of, or sharing of information. And the other interesting thing about it, I think, is that as all of us in this work know, agencies change, people change, and sometimes you have the same circle of people that change agencies. So that interaction of constantly having our coalition partnerships allows us to know those changes rather quickly before they're even really publicized. Sometimes we know about the change before it happens. And it's very interesting to me because I have people reach out all over the state that ask us about who in my area can we contact to do what you guys are doing. And unfortunately, there's not a lot of other coalitions besides our Healthy Community Coalitions across the state that do what we do. I think Region 6 is known for its collaborations amongst agencies and the work that we do here, and how sometimes and I don't want to make little of what we do, but sometimes it's very simple to achieve our goals just because of the relationships that we have with each other and with our community. We are people bring us in now with open arms, where in the beginning, sometimes it was a little bit hard to get that door cracked open, to get that foot in there, you know. But it's amazing the things that we've accomplished with this, and how we've been able to support one another and again achieve those goals that we needed to achieve.
Thank you, Kitty, for sharing the work of Region 6. And there are lots of other people on this call, I think, that can shake their heads and know that they're a part of that and participated in that as well. Dr. Cyprian, I'm going to go ahead and give you a follow-up question as well. Would you share with us what other health equity issues do you find in your community, particularly in rural parishes?
Pretty much all of the health equity issues, particularly that have been discussed already today, food insecurity, socioeconomic status, housing status, are similar to what we see in rural communities. And what we've seen really prevail and stand out most, particularly over the last 2+ years, is really in the space of technology, ready and able and willing to shift to telehealth. Had CMS not implemented the audio visit, there would have been a wide array of individuals in the most rural communities who otherwise would not have had access to any health care. So we see, as a community-based healthcare provider, a need to provide the care where it's needed. So not only do we have brick and mortar facilities, we have medical mobile units that we take into some of the most rural communities. And it's great that Ms. Nguyen is talking about those coalitions, because that's exactly who we partner with to ensure that we're able to provide the access to the care where it's needed and when it's needed, and not all the time. So we understand that, and you know, that patients will go to the emergency room, and we work hard on our ER diversion program, but to create the access and the time, because especially in rural communities, everybody's not available to come to see a provider in a rural area between 8 and 4:30. So having the extended hours, some of our clinics operate 6 days a week, as well as our pharmacies, to be able to ensure that the access is available to the community at the time that it's needed. So creating the access when it's needed, where it's needed, and really, you know, it really is the bandwidth and the technology and the fiber. It's a fight that's going to be a long fight and a long road ahead of us. But in rural communities, that's prevailed the most for the parishes and the communities that we serve over the last 2+ years.
Thank you. And I think that, like you said, over the past couple of years, it's really put a spotlight on that and the need for us to address how to get to our rural communities and truly give them the services that they need. So thank you for pinpointing that for us. I think everyone here who has rural communities in their service area can relate to that. Dr. Holcomb, I'm going to ask you a question outside of year 2 that you knew about. It's actually one that we prepared for Reverend Greene, but you're familiar with the vaccine equity work that was done with the canvassing with Sinlaw Interfaith, where they went into the neighborhoods and did door knocks and offered vaccines to the community. So if you don't mind, I think you'll be able to answer this, if you wouldn't mind sharing with the group. Many churches participated in Sinlaw Interfaith's vaccine equity project over the past year. How would you explain how that work impacted African Americans living in those church communities in Central Louisiana?
Well, I'd be glad to answer, because we were very much implicated in all of that. So I think you have to talk about one thing right off the bat, and that's when all the stuff started, all COVID started, the administration made it very clear that they were going to view all of this through an equity lens, and that we would be concentrating on communities with high social vulnerability indices, which are largely African American communities. And so that is how this started. And so we had to make up lists of those communities in our area that had these high SVI indices. And those were the ones where we looked for partners, whether they were churches or whatever organization happened to be located there, to try and partner with them so that we would send teams that included canvassers who would actually go door to door, and then National Guard people, and then folks that would distribute these cash cards and so forth. So a very concerted effort was made right from the beginning to address high SVI in areas. And Louisiana was ranked with this, and they were given a score of 938 or something about that, because of, penetration into these communities. And the Southern average was 62. So we did 10 times better than all of our Southern neighbors in targeting communities. We worked with FQHCs, we worked with churches, we worked with community centers. And, of course, we ran into resistance, and we ran into issues where people didn't want to get it. And, but we had people from the community that were actually working in the community, the people who proposed these things and who encouraged them in their congregations were people well known in the community. We went back once, twice, 3 times, whatever it took. So, our rates are still not good enough. We had 45% vaccination rate, but as I mentioned earlier, the vaccine uptake in the African American community was below the white community for months, and because there was a lot of resistance, there was or availability or access issues or whatever. But then that shifted, and it shifted in November of 2020, I guess, and the Black population started having, I think 2021, had started having higher rates of vaccination than the white population. And it was reflected in nationwide drops in that the life expectancy went from going down to stabilizing or increasing in the Black population, but not in the white population. And so there was a huge effort made, and it's been nationally recognized that Louisiana was right at the forefront of this equity in vaccination.
Thank you for elaborating on that. And I think that it was really one of the up close and personal grassroots, door-to-door, community-based interventions or practices that was done throughout the state during the pandemic. So Reverend Greene isn't with us, but kudos to him and his church community and Sinlaw Interfaith, and you, Dr. Holcomb, as a partner with OPH doing this work in the community. Lots of people were involved. So I'm glad we were able to highlight that. I don't think we have any questions. Maybe, let's see, Jennifer Hainline had one. And I'll just toss it out, and whoever would like to answer it. How can we as consumers move our medical providers in Louisiana to be more consumer focused? For example, making appointment times and sticking to them, particularly for providers who serve lower income individuals and families. So would one of you like to address that? One of our panelists.
Well, I was going to just say that I think the federally qualified health centers have been really responsive in trying to do this. They've had Saturday hours, they have extended hours. I mean, they make a good faith effort. And of course, Medicaid's expansion has had a hugely positive effect in Louisiana. I mean, it's just, you can't look at that and not recognize how, 480,000 people, insured that weren't being insured, they're dropping in uninsured rates, increases in breast cancer screening, rectal cancer screening. I mean, treatments of diabetes, treatments of hypertension. I mean, this is truly a health changing deal, Medicaid expansion. But remember, except I think Arkansas did it, we're surrounded by states that didn't do that. And there's abundant evidence that this was a hugely positive thing to do for poor people, for people of color, and there are states that refuse to do it. So you just wonder what that's all about. Well, there are some problems with this whole thing is that the subspecialists are not required to accept Medicaid. And so there you run into a problem because you've gotten primary care, which is tremendously important at the FQHC level and other providers. But then if you have to refer on to a subspecialist, Mrs. Cyprian can contradict me if I'm not correct, but then you run into real problems because subspecialists are not required to accept Medicaid. And the solution is obvious, but completely unacceptable, is that your subspecialists have to take a certain percentage of uninsured or underinsured patients as a condition of licensure, and perhaps have some protection against malpractice or, something that makes it easier. Well, that was considered completely unacceptable to the subspecialists. But try and get a colonoscopy for somebody. Try and get, some dermatology exam. I mean, it's sad, and it's still separate but unequal, even though it's gotten less unequal. It's still separate but unequal services, and it's intentional and it's policy. So those policies can be changed if people have the political will to recognize it. And it's just not everybody's got that political will. And so you get stuck with things that don't change and are unlikely to change. And that's very, very unfortunate.
And you're right, Dr. Holcomb. Thank you for shining a light on the issue with Medicaid and the challenges that we still have ahead of us in addressing this. And it's time for us to wrap up this panel. It went by very quickly. I hope that everyone got some great information. We appreciate all of you participating, Dr. Holcomb, Dr. Cyprian, and Kitty. And Dr. Holcomb, thank you for speaking out about the program that Dr. Reverend Greene was going to share with us. So thank you again for your participation. And now I'd like to welcome Brenda Brechtel, who is Central Louisiana Healthy Communities Coalition co-chair, and we'll introduce two of our LHCC mini grant recipients. So Brenda is the Well Ahead representative for Region 6 and 7. She has worked with Well Ahead since 2016 and is also the co-chair of the Central Louisiana Healthy Communities Coalition. Brenda graduated from Louisiana Tech with a BS in Home Economics and an MS in Child Development and Family Relations. She also returned to LSU Shreveport for a degree in elementary education. After a 22-year teaching career, Brenda worked for a nonprofit for 9 years. Her hobbies include singing in the church choir, going to flea markets, reading, spending time with family and friends, and serving in her church's special needs ministry. Brenda is the proud dog mom of Sylvester, Riley Ann, Dax, Harmony, and Pandora. Go ahead, Brenda.
Thank you. I had to get in there, my dog. So can y'all see me?
Yes, we can.
Oh, okay. Okay, good deal. Thank you. I am really enjoying this conference. This is great information, and thank you to everyone who's here. The first thing I want to do is talk about our next two presenters. We have two presenters to talk about building community unity through healthy food. And our first speaker is going to be Audrey Coldy. And I'll read her bio. Let's see, could someone make it just a little larger? I'm just having problems with my glasses today. Let's see. Just a second, Audrey. Okay, I'll do my best. Maybe if I scoot back a little bit, I should say it's not my glasses, it's my eyes. Audrey Coldy is the Alexandria Farmers Market Director of Operations. She organizes the Tuesday market, helping, excuse me, helping connect community and local farmers, ranchers, and artisans. Raised in Southwest Louisiana, Audrey graduated from Louisiana Tech. We have another tech person here with an environmental science degree and with the passion for soil and plants, where a teacher shared the wisdom that when science excites you and community excites you, working with food is the natural next step. Since then, Audrey has lived in West Virginia, managing livestock and gardens while hosting high school and college volunteers, teaching sustainability, service, and community. She has served on a board-run food hub that managed a community garden, school garden, co-op grocery store, and a farmer's market. Then working in agriculture, education in Alabama, allowing kids to experience and question the food system they participate in and influence. Food is one of the connections of nature, science, and communities. Getting to listen and work in that system is such an honor and joy. And I'll hand it over to Audrey. Thank you.
Thank you, Brenda. I appreciate it so much. I am so excited to brag about our Alexandria Farmers Market today. It's been such a joy over the past 3 years to get to manage and help guide it through the ups and downs that have been all of our past 3 years. But I get to work with such amazing farmers and such an amazing community here in Alexandria that makes it all a lot easier to do. I am just going to see if I can do this real quick. Is that something, can you all see that okay? Awesome. I forgot to start it at the beginning. There we go. And so I just wanted to get started by just mentioning again, the mission of our market is to connect farmers and ranchers, as well as our community and community resources. And it is a gathering place, and we strive to make it a place of joy and learning and open-mindedness. So I know we've all been talking about community health all throughout today, and the part that our farmers market works most closely with is that food justice element. And that definition just meaning that like everyone everyone in the community has the right to exercise, to grow, sell, and eat healthy food, and healthy food is fresh, nutritious, affordable, and culturally appropriate, and grown locally with care and well-being for everyone, the workers and the consumers as well. So everyone has that right to have that food that's connected to them. And that food is first and foremost an intent for nutrition and not necessarily as a product to be traded. And so we get to work with some really awesome community members to do that and have some really cool programs to help us out to do that. As y'all know, we've been talking about it today. People in Rapides Parish are hungry and are undernourished, just not getting enough fruits and vegetables, as well as the number of kids on free or reduced lunches and the number of adults that do receive nutrition assistance programming. I know this data might be a little old, don't judge. But our first program to help address these is our Kids Club. It was started in 2017 and is just win on win on wins. We have partnered with Healthy Blue for the majority of that time period to give kids $5 to shop for fruits and veggies. And we funded, I think, somewhere around 5,000 shopping trips for these kids at this point over the past 5 years now. And it's starting to show those long-term effects that the kids that get to experience this kids club over and over again, they start to have this excitement and joy associated with fruits and vegetables that is so closely linked to getting to shop and have the market as that place to run around. I mean, oftentimes right now, almost 90% of the tokens are used for strawberries because they're delicious and local and amazing, but still it creates such an excitement and joy that we love it. And shout out again to Healthy Blue for being such great partners and consistent partners to fund that over so many years as it's grown. And then our second program that we use to try and address those food insecurities is our SNAP program. In 2018, we were able to get the equipment to start accepting SNAP at the farmers market, which was huge because whenever they switched to the EBT cards, it really kind of created a jolt in those connecting farmers to their EBT customers. So it takes a ton of back of the house clerical elements to work these SNAP card readers and things like that. They're developing all the time and making them better and easier to use, but getting it started was quite a hassle and quite an arduous journey. But shout out to Allison for getting it through. But we have been so lucky since then to be able to also offer matching funds. So up to the first $20 that people got off their EBT card, we were able to match. And for the past year, we actually were able to be funded to do unlimited match. And the number of families who would do repeat sales at the farmers market because they knew if they came and used their SNAP card, they could do all of their grocery shopping was massive, right? Like it's just doubled and then tripled again the number of families coming to the market and using hundreds of dollars off their EBT card to buy local meat and fresh dairy and fruits and vegetables. And there is research that's showing that whenever you shop at the farmers markets, you do create this culture and you're surrounded by people buying fruits and vegetables. And so the likelihood that you get to eat fruits and vegetables whenever you go home increases. It's just a grocery store without most of the middle aisles. So your options are more directly towards those outer food aisles. And so it is such an awesome place to get to shop. And I just think this video was funded by LHCC, so I wanted to make sure to share it with y'all, just how SNAP Match works the market. So it is worth bragging and showing. The Alexandria Farmers Market makes fresh fruits and veggies accessible and affordable for its shoppers. Our Market Match is one program for individuals and families with SNAP. Make your first stop at the welcome booth to swipe your SNAP and EBT card. The Alexandria Farmers Market, in collaboration with our community's sponsors, will match up to the first $20 in SNAP with Market Match. You'll receive the amount you swipe on your SNAP, EBT, and red tokens, plus the Market Match in yellow tokens. This shopper got $10 in SNAP tokens and $10 in Market Match to spend at the market, $20 altogether. Use red SNAP tokens for any SNAP eligible product at the market and use yellow Market tokens for any item at the farmer's market. Go shop the market and get some fruits and veggies, breads, jams, and jellies. If you didn't use them all today, no worries. You can bring them back and use them next time you come to shop. We can't wait to see you all on Tuesday from 3 to 6 at 2727 Jackson Street. The Alex. So in between the amount of DSNAP and PSNAP that were going into the community after 2020, our funds that went towards EBT and Match and Kids Club were able to just quadruple. I think if you look at the graph, it's like a 300% increase in the number of people using SNAP at the market. And so that really shows such a huge story of how much the people want to ensure that their community has the options and able to take those federal funds and move them to the community. And again, that was during the time period where we were able to do unlimited SNAP match. And so it just created, the amount of stories that can be told about the families who came and were just like sighed with relief, knowing that, even if things are a little bit more expensive at the market, that 100% of their money is going towards the farmers and that they're able to stretch those dollars a little bit further. And so it really is a beautiful place to enjoy growing together. And I'm just very appreciative to LHCC for helping us get that video made and just make SNAP a little more approachable for new people. Any questions? Okay. Thank you.
I put several questions in the chat.
Let's see. So let's see, questions. Facts make up more than 50% of the Alexandria population, right? Are Black people attending the market in any significant numbers? If so, why are they not reflected in the images? If so, talking about some of your efforts to get some Black farmers, Black population to the farmers market. Yeah, no, so our market is, our like vendors and everything are majority white vendors, and our shoppers are community diverse, but I think the photos, I don't know what photos I pulled, but yeah, no, we reach to our vendors, but our vendors are huge resources that are people of color into reaching our communities. And also we've worked with some churches and things like that to help reach a larger population growth. So for sure, it's something that we try and make sure that we're trying to reach by listening to our communities.
So are Black people attending your farmers market in any significant numbers?
They are, but that's purely, I mean, I've never tried to count just the distinction or anything like that. So it's purely, just from what I see. And so it is a diverse market, non-native speakers and people of color and everything like that, but I can't give any numbers to it.
It would be helpful to put Black people in some of your images. I have found Black people, many of them will not consume something if they don't see other Black people involved. And if you are in a city that's over 50% Black and you have a farmer's market and a significant number of Black people are attending, they would probably need to show up in your images.
Thank you. I appreciate that for sure.
I hope you can do something about that. And I hope you will do something about that, because we are talking about equity and access. So you want that to be reflected in your work, I would presume.
Yes, ma'am, I do. Thank you. I appreciate it.
Thank you for the questions. we actually thank you, Audrey, for your information, and appreciate the effort that's going forth. And I know that you'll take some of the suggestions and if you can, and do whatever you can. It takes money as well to do these things, so we appreciate it. Thank you. We have our last presenter, Michelle Kendall,
Okay.
Hammond Downtown Development District, and I'll let Brenda continue.
Okay, thank you. As Jamie was saying, our next speaker is Michelle Kendall from the Hammond Downtown Development District. Michelle Kendall is a community development strategist, systems thinker, and award-winning writer with a background in public health and leadership. Her career expands over several sectors, including economic development, agriculture, and government. Michelle's current role is Assistant Director of the Hammond Downtown Development District. In this role, she has led the completion of multiple major projects, including the Old Hammond Feed and Seed Revitalization Initiative and expansion of the Hammond Farmers Market. Michelle has a Master of Public Health and is a certified health education specialist. She is passionate about helping her community adopt policies and strategies that improve quality of life for all. I'll hand it over to you, Michelle. Thank you.
Hi, Brenda. Thank you so much for that introduction. And thank you for you guys hosting this. I greatly appreciate it. Before I start with my brief presentation, I do just want to start off, I think, the question that we received just a moment ago really does highlight, myself. I recognize myself as a white woman doing this work and that I have advantages that other people do not. And in terms of how our places and our community and markets that we put on need to be representative of our community is at the utmost attention, I think, for myself, and I hope for others as well. So do know that diversity is certainly something, as we are looking to grow our market, that we are actively trying to pursue, and all the great work to grow small Black businesses, which I do not cover in this presentation, but other work that we've done in Hammond to have small business owners, people of color, young people, and others have a more welcoming environment to operate and to experience the growth that are a part of these initiatives. So with that being said, I am going to go ahead and share my screen, I guess, if I'm able to do that. I'm not quite sure if it's been a while since I've used Zoom. I've been kind of out of the loop. So today I'll be talking about our Feed and Seed Revitalization Initiative, and it's in a roundabout way, we've utilized or looking at this space as a place for health to be at the forefront of our redevelopment and revitalization strategy. And so the Feed and Seed itself is a historic structure located in downtown Hammond. And just for a little bit of context, you can kind of see how long this work has occurred. Really, the impetus for us doing this work was actually initiated by us receiving a community garden grant by LHCC, which we're so thankful of. And you can kind of see the progress that we've taken over the past year to get to where we are now, which now hosts a farmer's market and a community garden. Just something that we did have in mind when we were developing this property was with our community input, with our outreach strategies. It was at fore and frontmost to our community that they see health, farmers markets, garden spaces, and unity around how this property is developed. So having a community space that is reflective of our community, not only being a place of business, we are ensuring that this property can give back to our community. This is just some before pictures of us getting started with the space. This was an old commercial structure, so it was a feed and seed commercial store. There was a greenhouse on site, a nursery, and that fell into disrepair over the past few years. So we were able to negotiate a lease with the property owner, and we currently have a lease on this property for a long-term period. So these are some of the before pictures that you can see. And like I said, through an LHCC grant, we developed a community garden space. And we have 4 raised beds and some in-ground plants. Like I mentioned, LHCC is a central partner. One of our beds are adopted by TARC, which is a disability, persons with disabilities. They teach lifestyle skills. They adopt a bed to use for their clients, and are able to just walk 1 block down from their center to host programming here for their clients. LSU Ag Center has partnered with us on healthy food demonstrations in coordination with what we have growing and during the farmers market. We also have a growing partnership with our Hammond City Court through our Common Ground mentorship program for justice-involved youth to learn about where food comes from and experience entrepreneurship skills related to local food and healthy food. And then the most recent partnership we have is with the Louisiana Children's Discovery Center, which services youth in all of Tangipahoa Parish, and they've adopted a bed to incorporate into their programming. And we're always looking for ways to increase our audiences that we're able to work with respect to our garden. And you can see some of the pictures here of some of our work days and what we have planted. We have lettuce right now. We've just planted tomatoes and peppers. And so the picture that you see in the upper left corner is the garden and its raised beds. And then in that gravel lot kind of in the back, that's where our farmers market sets up, which brings me to my our next sort of strategy of activating really a third place, or a place where communities can gather through innovative programming, kind of honoring the roots of the feed and seed property, the development of or the relocation of our farmers market, and the development of a community garden, kind of honor those agricultural origins. And so our move to this location was actually intended to be temporary, but we've experienced a lot of growth here and are looking forward to what that future holds. Additionally, we've held other items for people to connect through healthy food, such as a pop-up dinner for farm to table style eating, and hope to make that more accessible through a few other strategies that we have lined up with LSU Ag Center, and ultimately through developing a community food hub, which is something I'll talk about in just a moment. But our farmers market, since we moved over here and since I've taken the role of manager, have tried to expand access to fresh, local healthy food to our residents by initiating our SNAP program, which we just have recently done in December 2020. In Tangipahoa Parish alone, there are just under 30,000 residents that are SNAP recipients. We do have about 10 farmers that participate weekly, and over 30 vendors that participate weekly. And we're looking to grow the diversity of our vendors and trying to have a place for small business incubation, really at the core of what we're doing while addressing the health of our residents. We also have a partnership with Vouchers for Veggies, which is a program intended to increase access for low-income individuals with healthy food. So children who go to a well visit, if they screen for certain chronic conditions, we are a retailer in the area that accepts those vouchers, so that the market is a bit more accessible to people. And then we anticipate to launch a SNAP match to double those healthy food dollars, like Audrey was saying, in fall of 2020. And we are also well ahead, well spot. So our area is smoke free, and we are happy to have our place not only be a place where people can shop for healthy food, but they can also enjoy other, a smoke free environment and other aspects that lead to a quality of life that we know that we're all looking for. Additionally, we're piloting a nutrition education station, or NEST, with LSU Ag Center. We are looking forward to having an outreach strategy sometime this summer to have those organizations that I mentioned earlier, like TARC, the Children's Discovery Center, the Council on Aging. Sorry, there's a train going by right by our office, so you might be able to hear that. So that community members of all backgrounds can meet together and have hands-on experience preparing healthy food directly grown from our garden, or donate it from one of our farms that is located in Tangipahoa Parish. And so here's my contact information here. I'd be happy to answer any questions that you have. I will say that as we look forward to our market growing, that I understand the deficits that we do have, and the accessibility of our market can seem limited, but the direct and intentional work that we do with our community here in Hammond to have a welcoming environment, to increase representation, are certainly all aspects of work that I don't have all the answers to, but are always at the forefront of my mind when I'm trying to work on anything really related to our work, and particularly the growth of our market.
Thank you, Michelle. Michelle was our former co-chair of the LHCC, so it's good to see her back.
Thank you, Jamie.
So in that vein, I know we're close to time. And so at this moment, we are going to close out. We have one more slide. We can post a slide. It's talking about our 2022 community grants, which were built environment and tobacco focused. And these were the grantees. And we can, this is on our website and at our Facebook page as well. And so we'll just continue on to the next slide, Natalie, to end. So, to close out the summit, we wanted to know what is a key takeaway that you would keep from the summit. There's a poll question that Brittany will present, and also you can put your responses in the summit, in the chat. After the meeting, after the summit, sometime this week, we will send out a link for feedback on the summit. And before we leave, we also want to, next slide, thank our sponsors, again, the LHCC planning team. We have our co-chairs, we see our leadership team, communications, and the Region 6 representatives, all listed. We couldn't have done this without them. It was, a lot of work. And we also want to thank again, Louisiana Campaign for Tobacco Free Living, the CDC, Louisiana Cancer and Control Programs providing funding for the LHCC. And so thank you to everyone, those who attended, our presenters, our speakers. And you can follow us again on social media for our next summit, and for what do you want to see next? What are those things that we want to tackle after today? And so for those who have to leave, thank you for attending. But those who just want to, I can stay. If you want to network or talk a little bit, or just up to you. So we'll just leave it open for those who want to come. And any final words on anybody else, from anyone else? Brittany, I can't hear you. Are you?
You're mute.
Brittany, is the poll working? I don't see the poll.
It worked fine for me, y'all.
I didn't get it. Well, maybe. Okay. Look, if you're still on and you want to answer the question, just so we can have it, we're gonna put it in the chat and you can respond if you still have time.
Yeah. Can you hear me now, Jamie?
Yes.
Okay. It may have been, I switched my headphones a little while ago, but I just wanted to say thank you. I know a lot of people had summits last week as well. So, thank you for spending your afternoon with us. As far as the poll, if your Zoom is not updated, it may not pop up, but that's okay. Jamie has posted the question in the chat, and it is, what is one key takeaway you will keep from this summit? There's also, I believe if you just go to your options at the bottom of your screen, poll should be an option down there. And then you just click on that. The poll is live at the moment. So if you have the updated version, it should be there. And if not, just please utilize the chat. Jamie, I feel like we should have some exit music or something.
I didn't think of exit music. But if there's, we still have a few people on it. If anyone wants to come off mute and just talk, I have some couple of minutes. If there's anyone that want to express anything that they learned or want to take with them. And I see Jamila is on here. Jamila, again, she voiced our videos that we showed at the beginning of the summit. If you haven't seen them, we'll put them on YouTube. So thank you, Jamila, for lending us your voice.
Hi. I would like to get the emails directly from the Louisiana Healthy Community Coalition, because I have been in the coalition for many years before. But recently, I didn't get the emails. I will appreciate that can be sent directly to me.
Where are you located?
I am in New Orleans.
New Orleans.
I can send them my information, because when we work with Broussard and all that, we always met in different places here.
So we have Bradley Wellens. Would you put your information in the chat for to connect with the Healthy Communities Coalition in Region 1, the Orleans area? Bradley, would you put your information in the chat, please?
I don't think that Bradley Wellens is on.
Oh, he left. Okay. I'll put his information in the chat. Hold on.
Okay. And I'm sorry, how do you pronounce your name? Is it Mariana?
Mariana Montero, yes.
Do you want, or can you share your information in the chat with us?
Yes, I do it. Okay. I just sent in Golden Change, but I didn't put my phone. Okay, I will do it.
Yeah, or your email address, so we can make sure that we get you on our listserv, so you'll get our newsletters and our resources.
Oops, sorry.
It's okay. But we'll get you connected.
Let me do a continue.
Anyone else wants to have a question right now? If you're still on.
Hey, this is Diane. I was just checking because my computer kicked me off. So now I'm trying to get back in. But we're done, right?
Yeah.
Yeah. Okay.
Yes, we will post recording at the YouTube page once we overlook it, and we'll probably send out the link to everyone. What I plan on doing is creating like a resource list of, information from the speakers and things like that, and sending out to attendees.
Jamie, I'm rolling.
Say that again.
I'm rolling off.
Okay. Thank you, Jennifer. Thank you.
Thank y'all. Great summit.
Thank you.
Yeah, wonderful summit.
All right. I'm going to shut the poll down.
Do you want to share some of those? I mean, we're just hanging out. So
Yeah.
you can drop off. I was just making sure that if anybody had anything else they wanted to ask, we gave them that option in that space.
It's asking me to log back in. 1 second, but I can share with you what we only have 14 people participate. I learned a lot today about Louisiana health, but ensuring a healthy marriage and health equity is important. Collaborations are key. Collaboration and equity are essential. I am taking away many new ideas for improving access to minority communities in our area through existing and new partnerships. Great connections are being made across different agencies to improve Louisiana communities. Love to see it. Great SNAP program in Alexandria to help both farmers and those who are marginalized. I think that, we talk a lot about, and this is just a thought at the end, we always, we talk a lot about engaging minority communities, but we can't forget the rural communities, especially here in Louisiana. So that's one of my takeaways, especially coming from St. Louis and doing work locally. That's what I've been learning here. So, all right. Well, thank you, everyone. Be safe this evening and have a good, well, I'll just say have a good weekend because my weekend starts now. But everybody have a good rest of your week. So
y'all too. Thank you so much.
Thank you.
Thank you
guys.
All right.
Bye-bye. Bye-bye.